Hopefully you can see my screen. Hello, everybody. Thank you for allowing me to participate. My name is Dave Crandell. I'm a rehab medicine physician at Harvard in Boston, and I'll be speaking today on an update on rehabilitation medicine in Ukraine. This is a picture of a dog named Billion. I think that's white in Ukrainian. I met him along with many members of the rehabilitation team at the City Hospital number 4 while visiting Ukraine in July of this year. What's unique about this dog is that he is also a displaced pet from an occupied area of Ukraine right now, and yet he was providing some support to newly injured patients in Ukraine, and we'll come back to see later that how well he's doing in that role. So this is my first summit. Back to look at some of the material from the first summit, and I Kravchenko, Ruslan. One of the goals is to create a rehab network in Ukraine to ensure that the rehab of all the defenders and to hopefully return them back to a peaceful life. And this was one of the criteria from the first summit. Ukraine system of rehabilitation is still in its development stage. After the initial war activity started in 2014, members and representatives of NATO helped establish medical rehabilitation as one of the key areas developing cooperation, and that had been making some advancements. One of my friends and colleagues, Oksana Seiko, who was born in Ukraine, but now working in the US for many years, began traveling back to Ukraine as a rehabilitation medicine physician and offering classes and helping to raise the level of training in Ukraine. As a member of the International Federation Society for Physical Medicine Rehabilitation, there had been no formal training in our specialty until very recently. And again, because of the efforts of NATO and some collaboration with universities, it was only starting in 2019 that the specialty of physical rehabilitation medicine really truly began. And they took physicians who had other backgrounds in family medicine, internal medicine, and then started including them in the specialty, all until just last year, where the first new residents trained in physical medicine or rehab actually graduated programming. I go back to 2022 after the full-scale invasion, and I got this email from Jerome Lee, which I think some of you may know through his work with Health Tech Without Borders. And I responded to this email because of my interest in providing some training in Ukraine. And again, with the help of Health Tech Without Borders, we organized a series of lectures for rehab medicine practitioners in Ukraine. This is just a number of the series of lectures. I happened to give the first one. Again, just talking about acute rehabilitation, and other members both in the US and internationally participated from this project. It was through that collaboration that I met and began working with Dr. Serhiy Kolesnik from Venetia, who has been instrumental in coordinating ongoing programming as well as leading the effort in Ukraine to train people in the specialty of physical medicine rehab. And then hopefully some of you are obviously aware of the great work done by Dr. Vladimir Golik, who at that time was leading the WHO effort starting in 2002. One of the things that I could do from Boston was participate in regular meetings of the WHO technical working group on rehab. And part of the vision at that point was, how could Ukraine develop areas of rehabilitation excellence and then be able to grow that throughout the country. If we fast forward that to our trip to Ukraine this summer, I, along with two other physicians, joined a Ukraine-based program with Project Hope, where we traveled to a number of hospitals and rehab facilities, both in Lviv and Dnipro, focused in majority on amputee from the conflict. It was there that we experienced meeting with a number of rehab professionals, including at the City Hospital number 4, where they have developed a recovery unit, a rehabilitation unit that is now serving primarily military, but also civilians in Dnipro. And this is one of 7 rehabilitation centers of excellence that have now developed with the support of the Shupyk family. The director of the program at the City Hospital number 4 is Dr. Ella Pivnik. When the full-scale invasion started, the program there had only 3 members. They had a physician, they had an occupational therapist, and a physical therapist. But over the last 3 years, that program has grown significantly in both staff and in physical square footage within the hospital. They have now over 60 members. They include, in addition to physical therapy and occupational therapy, they also have speech-language pathologists. What they've been able to do is actually train other rehabilitation teams that have come and spent time learning with their program, and then they can return to the local areas. So with only being approximately 100 kilometers from the front, they're developing this rehab approach very close to the conflict zone. And touring that facility, you can see active rehabilitation happening at a very high level. One of the exciting things that I learned during that trip is that because of the work they're doing, new young people are realizing the possibility of rehabilitation specialists. In this case, occupational therapy. There were 15 new applications at the local university. Now they can see firsthand the role they're playing in helping wounded soldiers. As part of the Project Hope, we have developed a gap analysis focused on amputee care, and we've broken down that into a few key areas. This includes the problem of the math, the numbers, that the numbers of acutely injured are overloading the system from the front line, and then getting to what we call Role 2 and Role 3 level of care, which in this case was in Dnipro. And one of the consequences of that was that there were higher rates of complex limb loss, a high degree of infection, and a requirement for more secondary infections. And this would obviously impact the fitting of a prosthesis once they're fully healed. And despite the fact that we saw very highly integrated rehab services in the major cities of Lviv and Dnipro, it was made clear to us that this did not happen in the local areas, and trying to extend that to all regions of the country is a priority. Additionally, we identified ongoing mental health and integrating psychosocial care from the very beginning, and again, continuing to the local community. Again, looking at how you can build capacity in this area of rehab medicine is looking at ways to increase the number of physicians, including those trained in physical and rehabilitation medicine, occupational physical therapists, speech language pathologists, and ongoing integration of the prosthetists directly into the hospital-based care. As we traveled in Ukraine, there was billboards where you could see the opportunity that there's going to be a high number of amputees, hopefully returning to community and then being able to integrate these veterans directly back into the workforce. And this is a clear goal for the system. This is a slide of the therapy gym from the Superhumans Amputee Center of Excellence in Lviv, and you got to see an example of efforts directed at this population. They are serving a high number of wounded warriors, but unfortunately, they currently have a waiting list of over 700 people waiting to access their services. And one of the key areas is because of the high number of upper limb amputees, there's still a shortage of the number of both therapists and specialists with training in upper limb amputation prosthetic rehabilitation. And despite the being able to access prostheses, you still don't have a number of therapists who can work with patients one-on-one to improve their training. So ultimately, as I said, that the goal is to return soldiers back to function, and sometimes being able to return back to active duty, even with after limb loss. Again, this is a project that we've been working on, trying to incorporate use of augmented device, in this case, Microsoft HoloLens. This is not a VR device. In some ways, this is a way to do augmented visualization. And we piloted this technique here in the Boston area, where we've been able to deploy the HoloLens in remote location, and we can do real-time training with therapy staff. And this is something we're hoping to work on implementing on a trial basis in Ukraine very soon. Again, this gives you some of the ability to use the imaging to enhance gait analysis. So I'm happy to report that Billy White is functioning well in his role, and we continue to look to him to support ongoing efforts as a member of the rehab team at City Hospital number 4. Okay, I think I'll end there, and then if we have time for questions. Thank you.
Давайте подякуємо доктор Девід Крендел.
Let's thank Dr. David Crandell.